would like to extend a warm welcome to our today's speaker, Dr. Shubha Ma'am. I would like to introduce our speaker to you all. Ma'am have completed her UG studies from Ayurveda Mahavidyalaya Hubli in 2011 and ma'am have completed her PG studies in Agada Tantra from SDM College of Ayurveda Hospital and Research Center Udupi in 2017. Ma'am have worked as an assistant professor in Department of Agada Tantra in Ramakrishna Ayurveda Medical College and Hospital Bengaluru and Adi Chunchandgiri Ayurveda Medical Hospital in Bangalore. Currently serving as an assistant professor in Department of Agada Tantra in SDM College of Ayurveda, Udupi. Ma'am have published many research articles in OGS Care and national journals, presented many papers in national and international journals. Team Ayurveda is very happy to introduce ma'am to today's webinar. At the end of the session, we will be having question and answer sessions. Until then, I'll kindly request to all the participants to kindly mute your audio. Ma'am, over to you, ma'am.
Yeah, thank you, Dr. Monica, for a warm introduction. I hope the slides are visible to all. Is the screen share visible to all?
Yes, ma'am.
Yes, please let me know if the slides aren't changing. Yeah, as Monica has already mentioned, that today we'll be discussing about dermatological manifestations of visha, and I've not added chikitsa here. Once we discuss more about this, we'll come to know. We'll be discussing chikitsa, but it's not like the same as we discuss with other subjects. So before we go to the topic and we see the different manifestations of Visha, we'll see something about Twak. And this is information you would have all come across in your first BAMS. That is different layers. Ayurveda speaks of different layers of Twak as Avabhasini, Lohita, Shweta, Tamra, Vedini, Rohini, and Mamsadhara. The measurement thickness is mentioned as in Vrihi Pramana, and other diseases which might occur in this particular layer of skin has also been mentioned. That is Sidma Padma Kantaka in Avabhasini, Lohita it's Tilakalaka, Vyanga Nyacha, in Shweta is Mashaka Charmadala, Tamra it's Kushtha and Kilasa, Vedini it's Kushtha and Visarpa, Rohini it's Granthi, Apachi, Arbuda, Galaganda, Shlepada. In Mamsadara, it is
Ma'am, slide
Bhagandara,
has not
Arshas.
changed, ma'am.
Yeah, okay. Now is it?
No,
Is
ma'am,
it
it's in
changing?
this like second side slide only. Now it
Slide.
has been changed.
Yeah, there is a delay in display, I think. Now is it in third slide? That is Twakki
Yeah,
Ayurveda.
ma'am. Yeah, it in third.
Yeah, yeah, I think there is a delay. Uh, yeah, coming to this. With all your permission, shall we keep it as an interactive session? So, can anyone tell me why these particular diseases have been mentioned in these layers itself? Why not Kushta in Avabhasini? Why not the Granthi in Shweta or Tamra layer? Can anyone share any information? And that has much to do with the visha, action of visha, and different presentations, dermatological manifestations the visha is going to produce. So it is something to do with that. With that regards, can anyone tell me, like we would have all read about this, that these layers are there and this particular presentation is there in the respective layers? Can anyone mention why only this has specifically mentioned in these layers? So, none? Yeah. Importance of these diseases is dhatugata avastha. It has to do much to do with the doshic predominance at these particular layers, and the dhatu avastha and the Vyadhi Avastha, which is going to come up. So, based on this conditions, these layers and the respective conditions have been mentioned. Now, when we come to the concepts of Visha, there are many factors which will what affect the presentations of Visha at Twak Avastha. Twak. That is mainly the form of Visha. You might have, if you are second year BMS students, then you have a respective point in your syllabus mentioning factors modifying the action of Visha, wherein you will be knowing about the dose, which is the most important factor which modifies action of Visha. It could be, for example, if we say, if we take an acid. Now, when it is an acid, when it is diluted, added with other diluting agents, such as it could be water. So when it is more diluted, it might produce minor action on the skin, that is minor degradation of the skin or skin irritation might be seen. When you go on increasing the concentration, the effect is more, and the presentation we see is coagulation necrosis. Likewise, that is one example. Next, form of Visha. Now, once the form changes, such as solid, liquid, and gas, these three states of matter we see, and the in case of Visha, when the Visha is in gaseous state, the effect is more, and mostly it is systemic rather dermatological. Next, when we see the form, changing the form, when it is liquid or solid state, we see more dermatological manifestations, again based on other factors such as dose, affect to what is the point of contact, what is the route of administration. Again, a next point in your syllabus, that is routes of administration of Visha. When it is dermal, when it is in a solid form, it may not bring in much changes because the interactions of molecules, as you all know, skin forms a first layer of defense. Because of that, interaction of molecule in solid state is comparatively less, so you may find less changes when such a state, but the exposure is for a longer time, then you may see changes. For example, in the case of caustics, caustics is a term which is not only used for acids but also for alkalis, strong alkalis. When a person is exposed to strong alkalis continuously for a long period of time, he may develop dermal contact dermatitis because of them, which you commonly see as soap allergies in general practice. So, likewise, when we speak of Visha and dermatological manifestations, there are varied factors. It could be route of administration, it could be dose, it could be form, it could be the duration of contact, it could be the type, nature, the we call it as synergism, the individual sensitivity towards a particular compound. Likewise, there are n number of factors which will which will be supportive in a case of poisoning, and dermatological manifestations occurring because of poisoning. Now, as we all know, this skin is the outermost covering and is the largest integumentary system. That is, it forms the first line of defense. That is very well known, and it is a point of contact of an individual with the environment. Whatever changes a person experiences, when excess heat, cold, temperature variations, or filtering the foreign bodies, reducing contact with external poisons, is all done by the skin itself. Next, interfaces with the environment. Yes, I have already mentioned this. Now, coming to the histopathological aspect. Skin, as we know, it is epidermis and dermis is further divided into 5 layers. Now, there are certain presentations we see in a case of whether it's poisoning or sometimes even in pathogenesis of a disease, we see certain presentations. That is acanthosis. We'll see few presentations. Acanthosis, that is thickening of epidermis due to hyperplasia of stratum malpighi. Next, acantholysis. It is loss of cohesion between epidermal cells with formation of intraepidermal space containing edema, that is the fluid accumulation, and detached epidermal cells. Now, dyskeratosis. Now, abnormal development of epidermal cells resulting in rounded cells devoid of their prickles with pycnotic nuclei. These prickle cells, in if you have read about the general physiology, these are the cells present in dermis. Okay. Next is hyperkeratosis, that is thickening of horny layer of the skin, which will present in certain
That
poisons. We see hyperkeratosis. Yes, yes, Dr. Monica,
slides aren't moving, ma'am.
aren't moving. Now, what is the slide being displayed?
It's a third slide.
Now, what is at display? I think there is a. Is it histopathological terms?
No, it's nothing.
Ma'am, third slide is displayed, ma'am. This work in Ayurveda.
Okay. Actually, I have moved on. That's not related.
Now it's visible, ma'am. Histopathology.
Histopathology is visible. Okay, fine. We shall go with this presentation itself. If I put it on slide share, a slideshow, I think slides aren't moving. Histopathology is what I was speaking about. Different presentations. That is acanthosis, acantholysis, dyskeratosis, hyperkeratosis. Hyperkeratosis is thickening of skin. We shall see this as a presentation in few wishes. Parakeratosis. This is abnormal keratinization of the cells so that the horny layer nucleated keratinoids are seen in this. Next, spongiosis, intracellular edema of the epidermis, which may progress to vesicle formation in epidermis. This particular presentation you see in case of Lotha visha. Now, are the changes in slides visible?
Yes, ma'am.
Next, we shall see different types of lesions we generally see in the cases. First one is macule. You might have seen this. It's a circumcised flat change in the color of the skin, which is less than 1.0 centimeters. Less than 1 centimeter. So this is what is a macule, small raised area which is less than 1 centimeter in diameter. Next is a patch, circumcised fat lesion which is more than 1 centimeter. A patch is a larger region compared to a macule. Next is a papule, a raised solid lesion which is less than zero point 0.5 centimeters in diameter. Papules may become confluent and form a plaque. Now, once this dry up, they form a plaque. Plaque are dried, raised scaly lesions. Next, you see nodule. Nodule, circumcised, raised, firm lesion which is greater than zero point 0.5 centimeters and may have started as a papule. Initially, a papule, small raised lesion will be there which will grow up and become a nodule. Next, wheal. This is what is a nodule, which is a raised lesion. Next, you see a wheal. It's a firm, raised, pink or reddish swelling of the skin. Size and shape may vary now in a wheal. Usually, it's itchy and lasts less than 24 hours. Now, a wheal. Many of you might have experienced a wheal. Wheal is also known as an urticarial patch, wherein once if you have a contact dermatitis, some allergies, people call it as, in lame terms they call it as allergy too. It is once you have point of contact with an allergen, immediately you get itching in that region, and once you start itching, raised lesions appear which are pinkish and which are severely itchy in nature. So that is called as a wheal. Now, next, tumors. Tumor is a large papule or a nodule, usually greater than 1 centimeter in diameter. A pustule. Pustule is a circumcised raised lesion containing purulent exudate. What is the difference in pustules? Pustule contains pus, which may be cloudy, white, yellow, hemorrhagic in nature based on the components. Now, vesicle. Vesicle is circumcised raised lesion filled with liquid or semi-solid material may become infected. A bulla is a vesicle which is greater than zero point 0.5 centimeters, which has clear fluids in that. You see bullae. This is what is a bulla. It is like once you have a burns, you get a bulb raised lesions, right? That would be a bulla. Next, cysts. Cysts are firm, raised encapsulated lesions filled with liquid or semi-solid materials and may become infected. Now, cyst contains a material inside the component which is like chocolate and which is more viscous in nature. Now, these presentations are what we commonly see as a presentations due to visha in nature. Wheals, papules, macular lesions, plaques usually are very common presentation. Next, how does the skin react when we have a pathogen? Now, it is the same for a pathogen or a visha component. Now, as I've mentioned, why then you may ask me a question that if it is visha in common, when we see the properties of visha, it is dashagunokta. Then why do we see so many varied presentations if that is a question? Then dashagunas are present in all vishas. But what makes the difference is permutations and combinations of the gunas that will bring in the changes in the potency of visha. For example, when we say upavishas and when we speak of say strychnine is comparatively more toxic if we compare arca and uh, cupilu, that is the Strychnine saxomica. Which one is more potent visha comparatively? Can anyone answer that? Can anyone answer? If it is Kupilu and if we are comparing Kupilu and Arka, which is more potent poison? Yeah, I would take it rather. Kupilu is more potent. That is because of more Tikshna Guna and more Vyavayi Vikasi Guna in it, which helps to spread. And when we are that is the reason why we classify compounds into super toxic, moderately toxic, and less toxic. So this is what is the one of the factor which is going to bring in changes. Again, as I mentioned, varied other factors are also important, which is going to help to bring changes in the skin. Next, two responses we see. One is immune response, and one is like yes, that is inflammation. That is, see, once there is a puncture, there is a pathogen inside. Your mast cells, neutrophils act on it and bring an inflammatory response, and that you would be seen as an edema, which you generally see Vishaja Shota, and orals you see as wheals. That is by immune cells, a lymphocytic response. So these are the commonest response in which are seen immediately. Whether you take the examples of Vrishchika Visha. Vrishchika Visha, it is mentioned. What is mentioned in Vrishchika Visha? Can anyone mention? So if it is interactive, it would be beneficial to both of us. Or else monotonous is very similar to your uh, class listening. So if you would interact, it would be much more beneficial. So if you say take an example of Vrishchika Visha, what is mentioned in Vrishchika? Can anyone tell Vrishchika Visha Lakshanas? So Vrishtikasya Visham Tikshnam. Already it is the guna of the Visha is already mentioned. Why Tikshna guna is mentioned there is to highlight the importance of that guna, and these gunas are also not only important from the presentation, also while choosing the chikitsa aspect too. वृश्चिकस्य विषं तीक्ष्णम् आदौ दहति वह्निवत् ऊर्ध्वमारोहति क्षिप्रम् आदौ दहति वह्निवत्. Though all vishas are ushna in nature, here for Vrishtika Visha again आदौ दहति, the ushnata of that visha is highlighted more. So आदौ दहति वह्निवत्, immediately it will have dahana action. आदौ दहति वह्निवत् ऊर्ध्वमारोहति क्षिप्रम्, it moves upwards from the site of bite. Urdhvamarohati kshipram damshet paschat tishtati. Later, it gets reside at the site of bite. So, again, this why it is important. As priorly gunas is lagu ruksham ashvishadam vyavai tikshnam vikase sukshma, everything is discussed. But again, why they need to highlight these points is from the aspect of chikitsa. What is the chikitsa mentioned for this? Can anyone share chikitsa of Vrishtika? Sadhyo Vrishchikadam. Yes, Sadhyo Vrishchikajam Damsham. Yes, very good. Abhyanga and Grita. Why? And it is not just Abhyanga and Grita, but they have also mentioned it as Kavoshnena. Why? When there is Ushnata, Tikshnata already mentioned, why you have to use Kavoshnena? Here, the property Urdhvamarohati Kshipram is mentioned there, suggesting of, though it is Pitta Pradhana Visha, there is Vataja involvement. Because of Vata, Adau Dahati, Urdhvamarohati Kshipram is there. That's the reason सद्यो वृश्चिकदं दंशं चक्रतैलेन सेचयेत् विदारिगन्धसिद्धेन कवोष्णेनेतरेण वा कवोष्ण उष्ण sneha is mentioned to specify vata as well as specify the ushnata of pitta. Ghrita is a very good media. That's why, though it is good media, taila is preferred here. Why? Taila is when you heat taila, it will be a chikitsa for vata. That is the reason. First, you control vata so that the spread of visha is easily controlled. In the case of Vrishchika visha is mentioned here. So, likewise, that is an example why inflammatory as well as immunomodulatory effect you see basically you see in a case of Visha. Next, we will see different presentations, dermatological manifestations we generally see in a case of Visha. Coming to nuclear warfare, here in a case of nuclear warfare, there is more external injury seen. So these are caused based by because of beta radiations. Now, radiation dermatitis is a common factor, and chronic cases lead to keloid formation. Keloid formation is this, it's a type of scar resulting from overgrowth granulation tissue and radiation dermatitis. This in the below cases you see is what is radiation dermatitis. Here you see hyperplasia of cells as well as what do you say this keratinization of cells also you see in this case when it is chronic. So treatment for keloid formation would be excision followed by uh, steroid therapy in modern medications. Again, in our Ayurveda, you will have to excise it. These sometimes are progressive, but again, complication with this is repetitive occurrence. Recurrence is a problem with keloids. Next, we'll see some organic poisons. Arka. Kshira is known to cause skin irritation when it is in a point, when it is external contact, when the kshira a person is exposed to, he may over the skin he may get redness, inflammation, and vesiccation. Vesiccation is nothing but wheals formation or urticarial rash. which is seen. Now, this doesn't happen with every individual. As I mentioned, the toxicity is comparatively less. A person who is sensitive to components, allergens, may produce such a presentation, or in many, there might not be any reaction to. Local irritation, irritant poisonitis. Next, when it is eyes are exposed, it may produce irritation in eye, haziness of cornea, and can affect eyesight. Now, after treatment, you see there is a case where initially there is haziness of cornea. Post treatment, it is clear. With a chalazion formation. Chalazion is a small cystic growth, a nodular growth which appear over the eyelid. Next, treatment here would be clean the area with clear water, wash it with clear water, and just apply coconut oil with haridra. That would help. Or sometimes, in a more severe case, internal medications would be required. We'll discuss the internal medications at the end. Now, next is Langali. Can anyone tell me why Langali is known for in Agada Tantra? Langali is a known for what? Abortifacient. Yashasvi, that is really great. That is an abortifacient. Here you might have heard about use of upavishas in therapy too. Like Jaipala is used in alopecia. Here they have tried the Langali Mula Kalka application in a case of alopecia. It was uh, marginal alopecia which has turned into massive alopecia. That is again because of individual sensitivity to this particular compound. Before using upavishas, it would always be better to do a patch test on a patient, and patch test is done. A small portion of medicine is applied at the back of the ear or inner aspects of the thigh. Leave it for 24 hours at least. The maximum time is 24 hours, but if that is not possible, at least for 6 hours it should be kept. And if any changes such as wheals, irritation, itching, or any skin changes need to be noted, and later such medications should be applied. Okay. Massive alopecia in the case of Langali because of dermal snowy. Again, it's a Kshira visha. Uh, it has also produced a large corneal epithelial lesions with the stromal edema and mild anterior uveitis. Uveitis was also seen in this, and it was seen after 2 days of exposure. Now, this is again one of the factor. So initially, this visha may not produce any signs and symptoms. Later, it might be a remote reaction to a particular drug. Such things also need to be noted in a case of visha. Now, Caravira, again Caravira, contact dermatitis and sap, that milky exudate in Caravira can cause inflammation in sensitive individuals. Next, Gunja. Here, Gunja, people who are wearing fancy articles need to be cautious about this. Here, a bracelet was made with Gunja and it was used by an individual. Again, painful swelling with ecchymosis near the site of injection was seen here. Swelling was rapidly increasing here and followed by inflammation and necrosis uh, in this case. And then decoction of decorticated seeds was instilled in eye will produce a purulent ophthalmia. So now these medications, why you would ask why decoctions of this would be instilled in eye. These are certain traditional medications which are used for different cases, eye problems and all. They have used some traditional medications and that has resulted in such a presentation. Now, subcute injections of the seed extract has produced inflammation, edema, and possibly necrosis around the site. This is the case where you can see necrosis of the tissue around the site of injection. Next, ahifena. Ahifena is a drug which is used as a therapy. Ahifena, Sava, Adi medications you might have heard, which is prescribed therapeutically, as well as this is a common drug of abuse. uh, See, in a first stage of drug intoxication, flushing of face is seen. In second stage, you see contracted pupils, face, lips are cyanosed, itchy sensation all over the skin is seen. In the third stage, face is pale, lips are livid. Next, in chronic poisoning, you see dry skin and hair, characteristic pigmentations around the mouth, eyelids, and cheek. This is nodular growth which happens at the sites of injection. Now, you might have also heard by people who are taking injectables of drugs. In them, such presentation you see. And what happens is once they inject in a particular vein, they cannot do it more than 5 6 injections at that particular site, because that turns careless. The site turned careless and nodular growth will be seen. So they follow the path. They go in the path of vein where you see a nodular growth along the path of veins here. Such presentation in chronic cases you see. That is, even oral cancer can be seen in oral tissues in a very chronic case of Ayurveda toxicity. Now, again, when the synthetic compounds or synthetic alike compounds are used as a drug of abuse, because nowadays, more than these drugs, synthetic forms of these drugs are popular, or their extracts are popular because they give what do you say, that euphoric state better than these drugs. So, if it is an extract, that will have more toxic effects rather than the drug as a whole. Now, Dhatura. Dhatura is a delirium poison where you see 9 Ds. So, flushed face appearance of skin, dry skin, hot as hair is what is a synonym or mnemonic given to it. Next, photophobia, dilated pupils, red and injected conjunctiva is in scarlet rash. Here you can see over the tongue, exfoliation of the skin over most of the body. And if it is applied at an abraded surface, that may produce poisonous symptoms. In a case of Dhatura. Ballataka, again a very common drug, especially Pitta Pradhana people will experience this most severely. Now, uh, eruptions which may develop into deep ulcers and cause sloughing and even death if applied to scrotal regions. Again, to produce, this is a common drug for malingering or faying. Can anyone tell what is malingering or faying? Malingering or faying. Pretending, yeah, Ananya, that is great. It is pretending of having a disease. So here what they do, they extract the ballataka juice and apply over the skin where the ballataka due to ballataka a contusion like bruise like presentation will come up, or it will be usually eruptic, it will be sloughy discharged, what they say, eruptions will be seen in Pitta Pradhana persons. How to differentiate this bruise, malingering bruise and a normal bruise? Can anyone tell? How to differentiate is color change. Color change will be seen in a case of contusion, whereas that is called as age of bruising. That will not be there in a case of faying or malingering because of Ballataka Surasa. Next, again, there is a another variety of Ballataka which is called as Nadi Ballataka, where the fruit appears like your jamun, ನೇರಳೆ ಹಣ್ಣು, like that the fruit is, but once you cut it open, it has a seed and it has a yellow pulp and sleeres, what do you say, like sclera, serous exudatus there. It is very clear exudate seen in that. So what, it also is very severely toxic as bhallataka, but the difference is If it is if a person is more of kapha vataja prakriti, then in them it doesn't immediately doesn't produce any signs and symptoms. Initially it will be skin will be normal, but later on it will start with itchy patch. Itchy patch turns into macular eruptions. Macular turns into papular eruptions. Blisters will appear. Later skin starts necrotizing, and a slough and wound will be seen in an individual. That happens with the case of Nadi Bhallataka. So now external application, it's plain painful blisters with acrid serum, eczematous eruptions you generally see, and neighboring skin in contact happens like that. Now, when it is therapeutically indicated, such caution need to be taken. And once this usually they try, some people try this in a case of leukorrhea. Tail application to cause depigmentation. So pigment, not depigmentation, repigmentation. There again, such cautions need to be taken. If such thing appear, then the pitta need to be balanced in an individual. While prescribing it therapeutically to like Ballataka Rasayana. Likewise, many therapeutic yogas of Ballataka are prescribed. Again, method of preparation also plays important role here. Shodhanadi karmas to be performed well and later need to be prescribed. If such symptom appear, then you should have a caution and treat it accordingly. Vatsanaba. Again, it's a sweet poison. When it is chewed, imparts sensation of tingling and numbness to the tongues, lips, and mouth. And when it is swallowed, severe burning and tingling of lips, tongue, and mouth and throat is experienced. And over skin, skin becomes cold and damp with subnormal temperature. So this is what are the skin changes you see in Vatsanaba. Again, for Vatsanaba, internal medications plays important role rather external treatment. Kupilu. Kupilu, here, as I've mentioned, the visha is so toxic that it will produce death, and reversal is very difficult in this such case because of the prabhava of visha. So, once death occurs, you see livid patches may be observed on the body, which may be mistaken for bruise. Again, a drug which is commonly used to cause homicidal deaths, or uh, a person wants to what do you say, change the scenario of death and look as an accidental death. There such drugs are used. Next, coming to Jayapala. Jayapala, again, as I've mentioned, as we have seen in a case of Langali, here Jayapala is also used in a case of Ashodhita. It is used in a case of um, alopecia, that is hair loss. So what they do is they do prachanna karma, they make snakes over the sides, and then bhallataka with or without lemon juice is applied over. So this causes appearing of blisters and pustules. Once these pustules come up, later these pustules burst out and new hair follicles come in, and that's the reason it is used. When such prayogas are to be done, it need to be controlled. Checking the prakriti of a person is very much important, and balance the pitta in an individual by giving a nitya rechaniya dravyas. If it is not done, then the prabhava visha will be seen, and pustules may be seen throughout the body. Sometimes excess blisters may also be seen as a response. So that need to be cautious. We need to be cautious while administering such drugs. Bhang again, a common drug of abuse. So, first stage tingling, numbness of the skin, second stage bloodshot eyes are seen. This is more to do with the systemic presentation rather dermatological presentations. Other than, as I mentioned, if it is the alkaloids are used as a drug abuse in chronic stages, you see similar presentations as in ahifena, nodules at the sites of vein. Next, tobacco again. You might be very much aware with the tobacco presentations. In a chronic state, it's more cancerous. Oral cancers are very lip or cancer of lip buccal cavity is very common. Now, tobacco is used by soldiers to apply over the skin to appear sick. For malingering and faying, this particular drug is used. They use the juice to soak the tobacco in water and apply the juice over. Sickness appearance of sickness will be there, as well as rise of body temperature will be there in this. Next, in chronic worsening, dermatitis of hands. Again, there is a condition called as tobacco sickness in people who are in a relation with cultivation of tobacco. If you have seen or know information about tobacco, how it is manufactured, what they do is they cut the tobacco leaves and hang it in open air or in rooms for long time. The resin drips out of tobacco when it's completely dry. It is powdered and it is marketed. So now people who are doing this because of inhalation of this tobacco resins or exposure to tobacco resins, they fall sick. They have more respiratory changes, dermatitis because of contact with the resins. That is seen in people who are to do with cultivation, occupational hazard, you may say, with regards to tobacco cultivation. Next, Chitraka. Chitraka, external application of a root produces painful irritation and blistering. It also produces reddish brown marks which stimulates bruise. Again, Chitraka in Uttar Kannada, there is a practice of using Chitraka Moola in a case of jaundice. ಕಾಮನೆ ಬಂದರೆ ಈ ಚಿತ್ರಕ ಮೂಲ ತೆಗೆದು ಕಟ್ತಾರೆ. They tie it to the hands or the waist of a person. What they believe is this blistering is seen, that improves the immunity of a person, and immunological due to immunological response, the condition is cured is what people believe. So Chitraka Moola application is a common tying Chitraka Moola is a common practice in Uttara Kannada. Next is Eranda. Eranda, now dust from the residue also causes irritation of eyes, nose, and throat, sometimes dermatitis too. Again, comparatively less. If we are going to compare it with Ballataka and other Tikshna Dravyas, it is comparatively less. Now, if we see Jangama Visha, we see the dermatological conditions predominantly because of the again Swabhava of Visha. Swabhava of Visha is comparatively Tikshna when we compare it with Sthavara Visha. Again, though the pramana of Visha is less, as it is directly injected to Rakta, and the duration of exposure, though it is small, because of Visha Prabhava, Swabhava of Visha, the effect is seen is more. Now, if you see cobra crate, burning or tingling sensation or pain at the site of bite, bite irritation, redness, inflammation at the site of bite. In a case of recovery, slight necrosis in the skin is seen. Subjacent cellular tissue surrounding the bitten area later becomes fluffy and separates with a bigger ulceration. Now, in viper bites, if we are seeing, pain, swelling, discoloration, and ecchymosis is seen. Cold, clammy skin is seen, and excessive local separations, sloughing, and gangrene and malignant edemas are seen in this. Now, I have a question here. As you all know, the treatment for snake bites being ASV. So even when ASV we are treating a condition, the post bite complications, that is post bite necrosis, is always challenging when we manage a case with modern medications. Can anyone share why it could be? Because here we are giving the utmost available treatment, like so what is it, most superior treatment for snake bites, that is ASV. We will be administering that, but even then we experience a challenge in managing bites. But wound management becomes a challenging. Why so? Can anyone share why post bite management is challenging? What is ASV?
Anti-snake venom.
A Yes, very good. It's anti-snake venom. What is it actually? It is a poison in itself, right? What happens if you are administering ASV to a person who is normal? What will happen? It might give out anaphylactic reactions because it is poison by itself. How is ASV manufactured? You inject snake venom, make a cocktail of venom and inject it to horse, leave it for many days. It will develop, it will have an immunological response, and if it is having sickness because of this, that horse is discarded, that horse is not selected. Next animal will be selected, and likewise after certain days blood is withdrawn from it, and you separate, what do you say, immunoglobulins from it, and that is what is lyophilized, and ASV is produced. So it is a visha, prati visha is what you are applying here. So maybe that is the reason because of which post bite complications will occur. So how is that when you compare with ayurvedic management, and when we do an ayurvedic management, especially in viper bites, it gives a better results, and post bite complications are less because we are doing, maybe because we are doing here nirvishikarana by using vishahara aushadhis. Maybe because of that, uh, the post bite complications are comparatively less when it is managed with ayurvedic management. Next, Luther. Again, in Luther, you get a local irritation, burning, some sensation. If you see Luther, Visha Prakarana, there day-wise changes of skin have been mentioned, day-wise changes in the presentation has been mentioned, and death has been mentioned because of later complications, neurological complications which might occur. So now, in a case of Lotha, what is important is herpetic type of cluster. There are clusters of what do you say, eruptions which are present. What is important in Lotha? क्लेदेन यत् स्पृशेत्यङ्गं तत्रापि कुरुते व्रणं. You might not get a history in Luther, as Luther has come and bitten. You might get a history that I had hanged my clothes and Luther crawled over it. Luther is what do you say, spiders, right? Now spider has crawled, or I was cleaning my house, just spider fell on me, I just rubbed it off, its exudates were in contact with my skin, and later I had such presentations. Likewise, you may get a history, or you might not get any history. Sudden I wore this cloth, or I had this particular component was in contact with my skin and I had this eruption soon after. That might also be the history in a case of Luther. So, one point to be considered here in a Luther is kledene its prashetyangam tatrapi kurute vranam. Wherever the exudates touch, there you get a new eruptions, very similar to the other clusters of eruptions you see. That is an important factor. If such a presentation is there without any having any doubt, you may go with Luther Visha management. Okay. So now, in a case of Vrishchika, as I proudly mentioned, wheals, urticarial rash, severe edema at the site of bite, burning sensations, radiating pain would be important features in a case of Vrishchika. Bees or valves, local irritation, burning pain. Now again, when we consider Keta Visha, they have classified as Mandavisha Ketas, Tikshna Visha Ketas, likewise, Madhyama Visha Ketas, likewise you get, and based on doshic predominance, again Vata Pitta Kapha have been mentioned. Now, again, if you see a bite of bees and wasps, when it is one bee or wasp which is giving a bite, it will be painful but manageable. Once multiple bites are there, they are more anaphylactic, systemic, and mostly they cause death in an individual. So again, various factors in visha. See whether it is manda visha, tikshna visha, madhyama visha, whatever is the swabhava of visha, how it is entered the body, and how it is. I mean, how long it is in the contact with the body. What is the nature of visha? There are so many factors which are acting upon. So I'm telling this multiple times in my presentations because that is what will very in every each and every case of visha, and that need to be correctly taken a note of while taking history, and later treat it will help you to plan out the treatment. Next, when you see acids, as I've already discussed with this. So, if you compare nitric acid and sulfuric acid, see xanthoprotic reaction, what happens in nitric acid, and that's going to leave a stain on skin, whereas it is coagulation necrosis, what happens with sulfuric acid. Coagulation necrosis at the side point of contact, there is coagulation initially, later which is going to lead to necrosis. That's why we call it as coagulation necrosis. So you see dehydration, because sulfuric acid is also hygroscopic, that absorbs moisture from the skin, and it immediately leads to charring of the skin. Next, eschars are formed. Eschars is something like keloid, wherein strictures in the tissue, which is granulating, is seen, that forms eschars. Next, tongue is swollen if it is tried to ingest it. There was a case of sulfuric acid. A woman visited some jewelry shop where they keep this acids for checking whether it is original jewelry or not. Likewise, it was kept. It was mistaken. She mistaken it for water. She drank it, and soon the attempt of drinking it leads, because it is concentrated. She spilled it out, and she had glossitis, swelling of the tongue, with white coating over the mouth, and which turn black or brown in color. Later stages, severe dysphagia will be there. Dysphagia to liquids also will be there. So for 3 to 5 days it will be managed with IV fluids, and later local steroidal treatment would be required in this. Here Ayurvedic management might be difficult in such severe cases. Next, in a case of nitric acid, lips, tongue, mucus of mouth softening will of mucus of mouth becomes softened. Okay, here teeth are yellow because of xanthoprotic reactions, which happen because of the protein in the skin and this acid, which leaves a yellow or orange stain. Next, aspections. Aspections, definitely they bring on very good color change, and known for post-mortem lividity. That is a cherry red appearance. You might have seen that is when a person is alive. Cyanosis is a very immediate change, which is well appreciated in a fair complexion person. Next, this is what I was mentioning as keratosis, like thickening of skin, which will happen. This picture depicts raindrop pigmentation, like small nodular growth you see along with thickening of the skin. Usually happens in arsenic. Again, in case of occupational, it's an occupational disorder. Person who is by occupation in link with arsenic generally experience this particular condition. Other neurological presentations such as stalking glow pattern, whereas neuralgia will be there in this pattern. Uh, Next is mercury. Again, acrodynia. That is pinkish hands, foot, and face. This was a very common presentation earlier. Nowadays, you don't find, because more consciousness regarding heavy metals is there in general public. Previously, we used to get this case because mercury was a component which was used for cleaning diapers, for making it what is it, disinfectant. Was a common disinfectant which was used. So because of that, acrodynia was a common presentation in children. So nowadays you don't get this. Uh, Instead of that, we get various present other presentations. That is grayish white coating around the mouth, Aldrich Mees lines is common, really seen in mercury too. Gold. Again, you might ask, now gold has become, it's very costly. But even then, reactions to golds. Why does that happen? As you all know, gold is an inert metal, right? Why would that give reactions? Can anyone share? Why would gold react? Why would there be any dermatological changes because of gold? See, as you all know, impurity of gold. Now, yeah, impurity, we cannot take it directly as impurity. As you all know, gold is most malleable and ductile. That means you can make thin sheets of gold, as well as you may draw it into wires. To When you want to make it jewelry, you have to add additives so that the form is retained for a longer time. If you have a jewelry which is easily breakable or easily foldable, that might not give a good impression. So they add in what copper they add in, which is a one common. Tin is another component which is added in jewelries to make it hard to retain the form of gold. So this is what are components which will cause dermatological changes when they are added to gold. So reactions of gold is because of these compounds rather than gold. If that's so, Swarna Prayoga may not have been mentioned by Acharyas. If gold would have, and gold is a first and foremost component which the Acharyas have told us to introduce to such young age as in infants, right? Swarna Prasha, from there, that is the metal which is being told to introduce to infants. So if it wouldn't be safe or it would be reactive, and definitely acharyas wouldn't have mentioned that. So this is not with gold, actually with additives which are added to gold, bring exfoliative dermatitis or erythema of skin, or dermatitis when it is continuously used for a longer time. So again, copper. Next is copper. Copper has much to do with neurological changes when it is for a chronic period. And again, copper, if it is metallic, as you all know, copper vessels is a common entity in household, especially in Indian homes. You can find copper and brass utensils. Copper again nowadays has become popular because of its again effect. What do you say? It has immunological, immunomodulatory effect, and it is what do you say, antibacterial. Likewise, it has become popular. Okay, now copper, it will produce toxicity when it is in synthetic form. If you say take sulfates of copper and other synthetic forms of copper, it is more toxic rather than copper metal. Again, in copper metal, leaching of copper happens. If you have seen a copper vessel, if you keep it as such for a long period of time without washing it or without making any changes to it, it turns black. A blackish coat is there on it. What is that? That is oxidized form of copper, which happens because of environmental changes. When such component is used as such while for cooking or for consuming water or some other entity, again, if you are taking acids, cooking acids in copper, because of its reactive nature, it might produce toxicity, or else usually you don't find uh, toxicity because of copper. And if so, it has more neurological. If you see the toxicity of copper, it is more neurological rather than dermatological. Next, other than its synthetic forms, you don't get dermatological changes in copper. Again, jaundice in subacute copper subacetate. There you see jaundice. Greenish or purple lines on gums. In chronic poisoning, you see hair, urine, and perspiration becomes greenish. That is again because of the oxide form of copper which is occurring especially in synthetic compounds. Direct contact dermatitis or eczematous lesions, as a metal, and uh, as a metal it's mostly non-poisonous. Other than leaching, when it happens because of copper leaching toxicity, you don't find it. Again, you might have heard incidences of copper vessels were used for cooking and led to food poisoning. That is a common scenario, also happens because of leaching of copper. Now, if it's an alloy with other metals and when it is finely powdered, that might lead to toxicity. Tin, again, as I mentioned, um, it causes skin burns, and when it is in contact with dibutylene chloride, again, this is one component which will produce toxicity. Now, we had seen certain poisons and its dermatological manifestations. As I've mentioned, uh, visha, various factors are there for a visher to cause dermatological manifestations. Again, why dermatological manifestations plays a very important role in visha? As you know, the karma of visha, uh, deham pravishya yadravyam, in dushi visha, like any visha, once it is in contact with poison, if it is not removed from the body, treated right, then it will either result in dushi visha, or when it is in a larger dose, when it might be toxic. Smaller dose over taken period of longer, I mean exposed for a longer period of time, will lead to garavisha. So any visha at the end, whether it is tavara, jangama, kritrima, anything, two under two umbrellas it falls, that is either garavisha or dushi visha. Now whatever is the visha, once it enters the body, it cause, it is also mentioned that dushayitva rasadikan, and in certain references it is mentioned it vitiates rakta initially, later it goes to other body, other factors of the body, and cause, ultimately cause death of an individual. Now when rakta is mentioned there, raktantargata rasa is also there. And or you might have also experienced that twak is a santanika, that is a cream. As you boil milk and cream comes up, it is a santan, that is what is a creamy layer or the rasadhatu. So whatever is the doshic involvement, as the visha is pittakara, that is vitiates pitta more, rakta is the dusha, all these factors are responsible for the visha to produce dermatological manifestations, and dermatological manifestations plays a very important role in identifying the visha as well as treating aspects. Next, whether it could be Vishajashota, it could be Shofa, Adi, or whatever types of presentation, Visarpavat presentations, whether it is urticated, rash, whatever is the presentation, it is because of the Swabhava of Visha and other factors which are responsible for visha action. They produce more dermatological manifestations. So here next I would show you a case, and this is a case of a dushi visha, wherein this lady was exposed to hair dye. She has used hair dye multiple times. It has not given any reaction. One fine day she applies it, the same what is the same company product she was using for a longer period of time. One fine day it has soon after application of hair dye, her face got swollen up. She had angioedema, and she later went for a consultation. After many consultation, her conditions, angioedema and all, resolved, but she started getting hyperpigmentation. She had modern consultation too, wherein steroidal treatment she had taken, but the pigmentation got worsened. And this was the picture when she consulted us. We actually again, if you consider the concept of dushi visha, what does dushi visha say? What does the concept of dushi visha say? यत् स्थावरं जङ्गमं कृत्रिमं वा देहादशेषं यदनिर्गतं तत्. Mm. So whether it is Thavara Jangama or Kritrima Visha, once it doesn't exit the body, when it is not eliminated from the body completely, and when it has supporting factors such as Dushit Desha, Kala, Adi, it will one fine day get aggravated. So considering this, initially we have administered Dushi Vishari Agada as well as other Rakta Shodhaka Dravyas for this lady. But the result was very slow. Then we thought of we planned of going for Shodhana Karma, as that's what is mentioned in Dushivisha. Initially, the patient was not comfortable with Shodhana. That's why, though the Chikitsa Siddhanta says, Dushivishartam susvinnam urdhvam cha adhashta shoditam, then you have to give Dushi Vishari Agada. So first we have to go for Shodhana, but as patient was not comfortable, we went for administration of Dushi Vishari initially. Later we planned for Shodhana, and this patient did not cooperate well during the process of Shodhana. So Shodhana process was not complete. So next treatment is what is mentioned in next is Ghrita Prayoga. Ghrita Prayoga is what we thought of in this particular case, as it is mentioned that Sarveshu Sarvavastheshu Visheshu na Ghrutopamam. So Ghrita is utmost chikitsa, as it is mentioned in Visha condition too. Then we plan for Pravicharana Ghrita administration, that is in a small dose. Ghrita was given daily. That gave a very good result. The pigmentation within, like, she was having this complaint since a long period of time. It was around 4 to 5 years since then she had this complaint, and within 3 4 months that pigmentation has reduced. You can see after this case is still under follow up, but you can see the change. It is remarkable since then. So this is one condition to mention, wherein uh, as I mentioned, Visha is something which is very difficult to predict. Like what is the dose, and proper history taking would definitely help you. Again, Visha samsarga might have occurred, and patient may not give you a connectivity with Visha samsarga. But say if you're not uh, getting good results with Kai Chikitsa line of management, sometimes it is always better to go with Agada line of management. That gives remarkable results in a shorter period of time. There will be Visha Samsarga. In current day scenario, if you see, even if you want to just breathe in air and survive, there is Visha in air too. So your Vayu, Jala, Bhumi, everything is Vishakta itself. So whatever you eat, there is some or the other form of adulterant in your food. So one or the other day, I think most of us will end up with the case of Tushi Visha itself. So if we want to uh, plan a treatment, as I mentioned, whether it is local or whether it is ingested. What is the form of visha? How is the point of contact? Based on that, you can plan out chikitsa. Now, if we take an example of Bhallataka visha, if it is external, for Pitta Prakriti person, it is just sufficient to go and stand near the Bhallataka plant. The breeze which is coming from that area, the contact with the breeze is sufficient to produce eruptions. If such is the case, external application or just coconut oil with haridra might be sufficient. When it is ingested, if say some bhallataka rasayana, bhallataka prayoga in the form of rasayana, or some other internal drug administration is happening, in that case, internal some shodhana based on what is the chronicity of the case and what is the dose which was taken in, how long that person is being taking the drug. Based on that, you can either plan for Shamana Chikitsa or Shodhana Chikitsa. Basically, it is symptomatic in nature. Next, Visha specific. As I mentioned, again, if you consider the case of Bhallataka, Bibitaki has been told as a antidote for that. So, Bibitaki Prayoga in the form of Kashaya or Parisheka. Likewise, you can use the concept of Chaturvimshati Upakrama. Based on that, see again, one point you have to remember in a case of Chaturvimshati, that it is not the one after the other you are going to plan the treatment. It is based on the case. You will make the proper selection of Chaturvimshati and apply to that particular case. Say Parisheka is required, choose Parisheka, formulate the drug as per, and then administer. Like Mantri, if you take a case of Vrishchika Chikitsa. There are tribes in India, especially Rajasthan and Gujarat, where they are well versed in doing mantra chikitsa for Vrishchika. So likewise, these are though Chaturvamshati, they are very good, very what do you say, excellently sorted out therapy methodologies which are going to give a very good result, especially in a case of visha. They are specially formulated and listed for a case of visha. Now you may select one chaturvimshati, one among chaturvimshati, or multi-drug therapy, parisheka, lepa, together you may do, or give aushadha parisheka lepa, 3 or 4 treatments you may select as per a case. Okay, if a case you take a sarpavisha, there will be doing parisheka it's a mandali in pitta pradhana, there they will do jalasnana, they will come continuously pouring, as you see a shivalinga being continuously poured by water. Similarly they will do dhara of jala, simple sheet jala dhara, it is done. Along with that, internal medication is what do you say, is given simultaneously. If it is an immediate case of say a snake bite, they will do utkartana and nishpedana. After that they will do what do you say, uh, they will also do other treatments, Arishtapandana, together. So, multi therapies are applied at a particular case, and selection of Upakrama should be that way. Next, Garavisha or Dushisha. As I mentioned, in a case of chronic, if it is a case of what do you say, subacute toxicity, or if it is case of acute toxicity, then it falls under the umbrella of Garavisha. Now, in Garavisha Chikitsa, again, Shodhana has been mentioned, Vamana has been mentioned as Chikitsa. Swarna Prayoga definitely gives a very good result in a case of chronic toxicity. Some Swarna Bhasma or Swarna Prasha like method you may adopt in a case, or Swarna Kalpas can be adopted in a chronic poisoning cases where your what do you say, immunomodulation effect can also be seen along with Vishaharatva, as Varna is also Vishahara Dravyas. Likewise. Next, in a case of Dushivisha, as I've also already shown in one case, so you may adopt Dushivisharyagada as it is mentioned at most Chikitsa. There are for Dushivisha, likewise, along with that, other formulations can also be taken up. As in this case, we have used Grita Prayoga along with Agada Yogas. So, likewise, you may go with Chikitsa Siddhanta. A few Chikitsa Siddhanta I've already mentioned during discussing the cases. Likewise, in if you want to conclude this, as I've mentioned, important to know the mode and type of poisoning and other factors which will modify the action of fish, especially in chronic cases. If it is more than 1 year, it is almost Dushi Visha case. Again, accordingly, it need to be diagnosed and treatment need to be planned. Medical legal aspects also to be kept in mind while treating a Visha case. As I've mentioned, in few cases malingering and paying is possible, so that need to be considered. So with this I conclude my presentation, and if there are queries we shall keep it open for queries. If there are queries we shall take up.
Thank you, ma'am. Thank you for your presentation. Now the session is open for question and answers. The participant can come forward and ask your questions directly or through a chat box.
It was really great that students were interactive. There was some instruction from your side, and I really thank all the students for an overwhelming response. Uh, Thank you, Shreya. That was really a compliment. If there are queries, we'll take up.
Ma'am, there is
Hello,
one.
ma'am. One
One.
question.
Ye- yes, sir. Yes, yes.
Uh, Dr. Ashwini Reddy, ma'am, asked one question, ma'am. Honeybee
Okay.
line of treatment.
Sorry, sir. I didn't get the question.
Bite line of treatment.
Sir, sorry, really sorry. I didn't get the question actually. I got bite
One
treatment.
is the
What bite?
treatment for
Ma'am, what is
honeybee
the
bite.
line of
Honeybee.
what is the line
Honeybee.
of treatment? Yeah, ma'am,
Ha,
honeybee
yeah.
bite.
Okay, okay. Honeybee bite. Honeybee bite we usually treat with Bilvadi Agada, if you have heard of Bilvadi and Visha Bilvadi. Based on the type of bite, which it is, means how severe is the bite, based on that, uh, we apply Bilvadi at the site of bite. We ask them to powder it. If it is with Tulasi Swarasa, it is good. With Tulasi Swarasa, you grind the powder and apply it over it. Initially, if you don't have any medications available, Ghrita with Saindava, just warm it and apply it over the site. It will go off. But if sting is there, sting is supposed to be removed. Internally, Bilvadi can be given for 3 to 5 days. There are proprietary medicines such as Oswella, which is antihistamine in nature, that also can be prescribed.
Ma'am, there are some questions in the chat box, ma'am.
Yes, I should take a honeybee bite. Yeah, I think I've answered. Next, so many words. Ghrita, which was used. In this case, we have used Panchatikta Ghrita along with Dushivishari Agada and other Rakta Shodhaka Dravyas in this. Uh, Vyanga or hyperpigmentation. Yes, I have been posted in Sringara department at SDM Udupi, where I have experienced. It's my experience. I've experienced hyperpigmentation as a cause in people using this, what you call it, as sunscreen lotions. Uh, Previously they were not using, suddenly they started using and noticed hyperpigmentation once they stopped using or during their use. This is one common entity I have noticed during this period of my tenure in Sringara. So what I generally do is I prescribe them Dushi Vishari Agada. Along with that, local therapies we perform at Sringara OPD. It is like Sumuk, that is a procedure called Sumukha Prasadana, wherein we'll be applying some Vishahara yogas over the face. Uh, it is a list of procedures we do for 3 to 5 days, and we ask them to do follow up every month for 3 to 5 months. Likewise, like every month, 3 days they have to do it for 5 months. Likewise, and that has given very good result. Few hyperpigmentation cases, the pigmentation has reduced. Again, in people who have restarted using the creams or say sunscreen lotions, again they have experienced repigmentation. So if it is a hormonal condition like post menopause, few people experience hyperpigmentation. So in them it is very difficult because of the hormonal involvement. So internal medications, shodhana therapies may give better results, but say just if they want the pigmentation to reduce, application of your kunkumadi taila regularly, that is not during this. Ask them not to apply it during sun. I mean, apply the cream and then, or kunkumadi lepa, then go to sun. That is not I mean, generally not advised. During evening hours, by 6 they apply, and before bed they may wash it off or keep it overnight, and next day they may wash. That has given good result. Pigmentation has reduced, but complete cure, in very few cases I have seen. I have not seen in many cases. Next, Vyanga is, what was that? Explain them that we can also adopt. Yeah, I have explained, I think. Uh, harmful chemicals in cosmetics, and all the cosmetics, to the extent that anything labeled cosmetic usually are labeled herbal until and unless the complete herbal drug is used. To my perception, it is a cosmetic itself, wherein the base, you see Ayurvedic shampoos, the base is always a chemical, and later extracts are added to it and called a herbal. I think mm, I don't know how to convey it. It is chemical itself, it is synthetic drug itself. So it is always best and better. What Shringara methods, it is maybe I would be called as an old school after this, so be it. But it's always better to keep your skin as natural as possible, and the skin is the reflection of your gut, that is for sure, because the good and the better your gut is, the skin is as healthy. You don't have to apply anything over your skin until and unless you have a very good gut. So I'm not boasting here anything, but I usually don't apply anything over my skin. And until and unless you don't have any hormonal issues or any gut related issues, your koshtha is clear, your agni is good, your skin is better too. So uh, there are many yeah, leaded compounds, though there what do you say, uh, instances of leaded compounds have come down. All the cheap cosmetics which is available contains lead, magnesium, and other compounds, synthetic compounds, shampoos as well. So mantra chikitsa, how it's useful in a case of bite. Again, mantra, while mentioning, they have clearly mentioned it is not some XYZ person coming and uh, reciting mantra or doing it. देव ब्रह्म ऋषिभिः प्रोक्ता mantra satya tapomaya, they have already told. Again, the vidhi how mantra has to be practiced. It is not one fine day I sit, I recite mantra for 100 times and I'll get the siddhi over it. It is mantra is something to be experienced. The rhythmic what is a notations which is there in the mantra is going to bring in some somatic changes. Now if you ask me what is the change it is going to bring, it's very difficult to explain. And I, if you want me to demonstrate it on some platform, it would be very difficult, because it is not a one day, it is not a what do you say, a matter of one day. It is to be done stri mamsa madhuvarjita, all that regime is supposed to be told, is told in a person who is supposed to practice mantra and get siddhi. When it is continuously done over a period of time, that siddhi will be attained and the person will be able to execute it. In few, it is through range, like familial, as I've mentioned, few folklore practitioners, you may call them, or tribes are there in Rajasthan and Gujarat who are practicing mantra chikitsa in Vrishchika Damsha. So that is a skill which they have got it from their familial background. So there are Kerala Vishavaidya Paramparas wherein they are treating snake bites with mantra. There are Kerala texts where you get references of mantra chikitsa. There is Padma Prayoga wherein in Kriya Komadi you get such prayogas wherein a person can call back the snake and ask to withdraw the uh, with the mantra. He can call the snake which has bitten him and ask to suck the venom from that person. So such prayogas have been mentioned, but we, maybe there are ethical issues, there are so many issues in current scenario where practice of these mantras are forbidden, as well as demonstration of the effect of mantra, seeing them is a difficult scenario. So though we find textual references, though we find examples in the history, near history, where such prayogas have been done, so it comes with experience. I think it is not just textual. Once you experience, see, it is energy is everywhere. How we channelize that energy is what matters, and this has something to do with that. So, ma'am, can you please still specific on treatment of Arka Kshira spread over eyes? Now, in that case where I demonstrated a modern treatment, methodology when was adopted. Rinsing of that local area was done. Later, antibiotic and steroidal drops were advised, which mitigated the condition, and such that clearance of sclera was seen. Same thing, yes, correct. After sudden bite of sarpa or vrishchika, we do the chushana of rakta. Do the person to poison because of some part of blood entering into the GI. Now, if you drink venom, nothing is going to happen because venom is protein itself. Now, that might turn in due course of time, it might turn as dushi visha, that's it. Nothing else immediately it will happen. But if you have ulcerations in your GIT somewhere, that will be penetrated into your blood, and same bite like signs and symptoms will be seen. That is what is uh, the difference between GI and Yavaya and Vikasikuna Fisher. Yes, that is what I think. Sagar Reddy, I've answered your question. What about treatment of melia? Uh, is that melia bug is what you're expecting here? Kindly answer if that's so. Next. Best Vishahara Dravyas we can use in day to day practice. If you could let us know on Dhatu basis. So now best Vishahara Dravyas. Now Vishahara Dravyas you cannot rate them as best or least because individually they have their own importance. Now as I mentioned, Grita Prayoga, Sarveshu Sarvashteshu Visheshana Gritupamam, it has been told. Why? Because it has its action on Agni, it has at Dhatu at the level, and it is not one day it is going to work, it is going to work on daily basis. In a due course of time it is going to show a result. That's why Ghrita has been told as an important drug in Hridaya Varana. Now Hridaya Varana is one upakrama where it has been told after bite 2, and as a daily regime if you practice it you may protect yourself from visha in due whenever there is an exposure to visha. So that also practices is mentioned, that also is mentioned. Now few Vishahara yogas which can be used in general practice is first and foremost Visha Vilvadi Agada. Now Vilvadi Agada is a specific Agada wherein specific part has been told. It is not like just take drugs and formulate it. Thing. Bilvasya moolam, surasasya pushpam, phalam karanjasya, natam surakvam, phalatrika, Vyoshanishadvayam cha bastasya mutrena susukshma pushtam. Now, what is here important is they have told susukshma pishtam. Now what is a classical reference for susukshma pishtam? Susukshma pishtam you don't get a classical reference. Now how to analyze it? Now few Vishavaidhyas opine that you have to take all these components, put it in khalva, and daily you have to add fresh bastamutra to it, that is ajamutra you have to add to this, and do mardana continuously for 7 hours at least a day. You have to keep doing to the extent that it this composition doesn't further absorb any more bastamutra. Till that you have to add bastamutra and keep on triturating it. Now at this stage it becomes so soft like gel that you can roll it out into pills and keep it. This is what is the best visha or bilvadi agada you can have. Now what is the market available bilvadi? What they do is they do bastamutra, they add in all these drugs. Again, getting bilva mula is difficult. Now how far the manufacturing companies add these drugs and prepare is again a question. But still market available components, what they do is they put bastamutra and triturate it for at least 8 hours a day and over 1 week. After that what you get bilwadi is what is market available bilwadi. Now even this bilwadi is giving very good results. Say it is a case of acute GE, you can use bilwadi along with jirakadi arista, and it gives a very good results. I mean, it is I have seen, I generally practice this and I have seen very good results, better than your loperamide or what is that other drug, riboprazole plus one drug you get. Usually better than that I have seen results with this bilvadi and jerakadi composition. I have tried bilvadi in case of what Madras eye, wherein I have used Bilvadi with Kshira and instilled as eye drops. That has prevented the instances of what's a Madras eye. That is conjunctivitis condition. That same Anjana in Anjana Prayoga I have done like that. Next, I have tried Bilvadi, same Bilvadi in a case of what do you call it, dengue. In dengue, I have tried Bilvadi with Amritottara Kashaya, and that has given very good results. Within 3 days, 3 days, I think I have seen the very good result I've seen in this 3 days. The platelet count has raised. Along with other patyas is there, Vishahara Patya. Not to forget something like your Yavagu. That is Koshatakyadi Yavagu. Very good. Pathya Yoga in Visha. So likewise, you have to, it is not just Vishahara Dravyas. As I've mentioned, Visha is a very great area to explore because every case is a different case. Visha Swabhava changes. Same Visha you give to 10 people, you will get 10 different cases, 10 different presentations. Uh, so telling one drug, that's why you see in my presentation regarding chikitsa, specific chikitsa I have not added because you cannot say a specific line of treatment in visha because the swabhava of visha changes, contact of visha changes. Likewise, uh, presentations is different in visha. Which are agada you have used locally to treat vyanga? Vyanga. Yes, Bilwadi is one combination I have used. Dushi Vishari is one combination I have used. So method same. I cannot put much like detailing telling methods. Cannot be. I mean, they have certain limitations wherein I cannot give out all the say details of what all Vishahara medications can be kept in. Yeah, Bilvadi, Visha Bilvadi. Very good drugs. You can keep it in your OPD. With again, I've mentioned few conditions where you can make combinations and utilize it. These two drugs very important. Likewise, Chandana Bilvadi is a yoga you can keep. Again, Lutha and Lodra Sevyadi is a drug you can keep. Um, Likewise, there are few medications. Dark circles. Dark circles, your simple kunkumadi might help. Again, for dark circles, you have to see what is the cause. Continuous monitor gazing is one. Nutritional debility is other cause for dark circles. Likewise, rule out the cause and you may treat it. To suggest some natural ways to care for and maintain healthy skin on regular basis. Gut, you maintain your gut health well. That would be more than sufficient to maintain your skin. Again, nowadays people are fancy about doing skin routine regimes and so many things. Again, simple application of milk over your skin or kunkumadi taila practice in the evening might keep your skin healthy. While explaining about spreading of Tikshna Vishad, have explained about Uttara Dhatu getting affected. Yes. Does same hold good for Dushi? Yeah, in especially in Dushi Visha. That's why in Dushi Visha, in other Vishas, though some dermatological manifestations Ashajas have mentioned, in Dushi Visha they are clearly mentioning Kotha as Aru as a what to say Lakshana. Topical lakshanas have been clearly mentioned in a case of Dushavisha. In Garavisha, again, as I've mentioned, those other factors matters for skin presentations. And Uttarottarasi, though, what happens in an acute case, Saptadhatu get vitiated, and based on the vitiation of Saptadhatus, the Vegat Lakshanas has been mentioned in them. So, likewise, when it is for a chronic, that's why in Dushi Visha last stage, when a person is towards death, he has made Viluna Pakshastu Yasdhavihanga. That is suggestive of severe Dhatu crisis in an individual. So, likewise, based on the case, you need to evaluate. Yes, thank you so much. White bumps on face. Uh, Extraction usually, yes. Again, Here, Upavisha Prayoga, you may think of, again, based on other conditions, systemic presentations, comorbidities, ruling out that, you may, this Upavisha Ksharas have been used for excision, that may be tried over it. Thank you, Ashwini Reddy. I will consider that. Rajeshwari, thank you. Yes, thank you so much. I think I have answered all the queries. If anything is there in the chat box, I'm sharing my mail ID. If anything of any queries is there later, you may post it to me on my mail. It was really great uh, interacting with you guys. And thank you for a really overwhelming response. I was not expecting such a response. I thank Ayurdrashti for the opportunity. I take this opportunity also to thank my HOD who actually pushed me to go for this, Dr. Chaitra Hebbar Madam. I also thank Dr. Srinidhi sir, Dr. Ravi Krishna sir, Dr. Ranjana ma'am for all the support. I hope your support continues for other presentations of Ayurdrashti too. Ayurdrashti is a really great platform.